I'll let them in. All right. So welcome everybody to today's Health Council talk. Let me share my screen really quick. There we go. So today we have two phenomenal presenters from UNM Center for Disability Development, and they'll be discussing New Mexico access to behavioral health for children. So we have Amy Glass and Susan Chacon with us today. All right. We'll start with our land acknowledgement. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nation, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And then a couple of reminders. Let's see, if you have any updates to your health council meetings, or information, if you could just send that to me, that would be fantastic. We have the, sorry about my cat. We have the Community Collaborative Forum, coming up on May 7th. The in-person registration is closed. We reached capacity. Very exciting, but we do still have Zoom attendance open, so we definitely encourage you to register and attend. Hopefully you got the email, a new calendar invite. Next week's peer learning session, we're moving to Thursday instead of Wednesday, and we'll be discussing transportation with the Department of Transportation, Harding Torrance, and Acoma Health Councils. And then finally, on Monday, May 12th, the Alliance will be hosting a Health Council reflection gathering, so we can discuss advocacy, funding, technical assistance, collaboration, and more. And I'm sorry if anybody's saying anything, I can't see the chat right now, but I'll get back to you. And then I'll turn it over to Geraldine to see if you have any advocacy updates to add.
Thank you, Sam. Just very quickly, I think you're all aware that we secured $4 million this legislative session. And so just an update from Val right now. We're still waiting to hear from DOH and our partners there about the procurement process for FY26. So please just be on standby. There will be a DOH reflection meeting next week as well. So more to come on that, and no other further updates unless there are questions.
Great. So again, we have our presenters from New Mexico Access to Behavioral Health for Children, and I will stop sharing my screen and turn it over to them.
Awesome. Let me share my screen, if I can figure it out here. There we go. Does that look okay?
Looks great.
Yes.
Yes.
Okay. All right. Let's see. So just to introduce ourselves very quickly, I'm Amy Glass. I'm the program manager for NMABC, which is a partnership between the New Mexico Department of Health, and Susan Chacon will introduce herself in just a minute, and the UNM Center for Development and Disability. So this is a federally funded program, and we provide free services across the state. Susan, did you want to introduce yourself?
Thanks, Amy, and thanks again for inviting us to talk about our project. Yes, Amy said, my name's Susan Chacon, and I am with the New Mexico Department of Health. and I'm the manager for Children's Medical Services, which is a program that provides services in the public health offices to children and youth that have special health care needs across the state. So again, thank you very much for having us. And this is a partnership between our two organizations. So
Yeah.
I will let you. There's our disclosure statement. We have nothing to disclose. So I'm going to start out just with a little background about mental health care services and in general, and then a little bit about New Mexico. And this may not be new information for all of you, but just to kind of give you a little background of how this project kind of got started. So next slide, please. So, overall, there have been a lot of concerns in the United States around mental health, behavioral health for children, and we have seen a huge increase pre-pandemic. The pandemic certainly took a toll on our youth and our kids, and we saw an increase of about 30% about mental health for mental health related visits for children. And now in the United States, almost 20% of children ages 2 to 8 have been diagnosed with some sort of mental, behavioral, or developmental disorder. And the youth suicide rate has increased dramatically from 60% from 2007 to 2021. Next slide, please. And there is a lack of access to mental health services to kind of address all these needs that we're seeing there in our communities. So according to some studies, some recent studies, this is a 2024 study, United States currently has fewer than 1/5 of the needed child and adolescent psychiatrists to care for youth with severe psychiatric needs. And most of the United States is underserved. When you kind of ask families what their top concerns are, a lot of it kind of falls back on this access to mental health, behavioral health care services for their children and youth. Next slide, please. So in New Mexico, of course, we have many challenges when it comes to access to health care in general and mental health care more specifically. So we're a rural state, and youth that are living in rural areas are more likely to struggle with mental illness and less likely to receive the services and have higher suicide rates than their urban peers. We have populations that are at greater risk. Mental health of people from racial and ethnic minority groups has worsened since 2019, which is pre-pandemic. And these populations experienced disproportional loss during the COVID-19 pandemic. And we know that here in New Mexico, and we all lived through that, and we know that that is true. We have a lack of economic resources. There's a lot of research that have been done around poverty and ACEs and stressors. And so that early and chronic exposure has been associated with poor emotional and behavioral regulation in adulthood, which impacts overall well-being. And unfortunately, we do have more disproportional rates of children with depression, substance use disorder, and other mental health diagnoses. Next slide, please. And we have, as you all know, because I think you all work on this, we are a healthcare professional shortage state in general, and 97% of our counties have a mental health professional shortage, and 75% of our counties have no child or adolescent psychiatrists. Next slide, please. This is a quote from Senator Jerry Ortiz-Pino, who retired last year. No region in the state meets nationally recommended standards. I see your heart, I'm with you there. For ratio of students to social workers, school psychologists, or school counselors. There just aren't enough behavioral health therapists, in addition to overall shortage, there is also a shortage of culturally competent therapists in New Mexico. Next slide, please. So where do children then end up for mental health concerns? And these are the places that they go. And, you know, primary care, they go to their doctor's office, urgent care, emergent, they end up in emergency rooms. And they're in school, you know, 5 days a week for, you know, 8 months out of the year. And so we have our school-based health centers and then our school staff. Next slide, please. So the role of primary care in pediatric mental health services. So primary care has been dubbed the de facto mental health system of the United States since the 1970s. And 40% of office visits for mental health concerns occur in the primary care office. 40% of prescriptions are written by primary care physicians. And this is all increased by 50%. With pediatricians, these numbers are very high. 93% had a patient disclose suicidal ideation, and 81% had a patient who attempted or died by suicide. Next slide, please. So this creates challenges, of course, for our providers. PCPs often feel out of their depth in diagnosis and managing youth with mental illness. And they lack a specialist to whom they can refer these youth to, or even, you know, make a consult with. So this crisis has been recognized by the American Academy of Pediatrics, Children's Hospital Association, and the American Academy of Family Physicians. Next slide, please. So this is where we come in, the NMABC project. And I'm going to turn it over to Amy to talk about what we're doing to try to support our providers during this period of crisis and lack of access.
Thank you, Susan. Susan is one of the PIs on this particular project. So she has been a part of it from the beginning. And we are very grateful to be in partnership. So PMHCAs, that's the acronym for it, Pediatric Mental Health Access Programs. It is a national model, and the whole goal is to support community-based providers in all the states of the country. So we're trying to increase the capacity and the comfort level of all providers in communities to meet the mental health needs of children and adolescents. Okay, and that's not just primary care providers, although that's the initial target audience was primary care providers, and they're still a very important part, but it's also pediatricians, it's general healthcare clinics, it's urgent care clinics, it's hospitals, it's school-based mental health providers, it's behavioral health providers who may not have psychiatric specialists available. Okay, so our goal, our services are all aimed at connecting professionals across the state with specialists, right? UNM has some wonderful resources, and this is a program that tries to offer some of the specialists' knowledge and those resources to folks who are working in communities all over New Mexico. So there are three main branches of what PMHCAs do. There's consultation, training, and resources. And I'll talk a little bit about all three of those. And the outcomes, these programs have been around, I believe, since 2018. I think that the first were funded, although the model came from child psychiatry access programs, which have been around even longer. They were started in Massachusetts like 20 years ago, I think. So Okay, so reduced emergency room visits are one of the outcomes that they have found these programs to be successful with. Improved patient satisfaction in healthcare and primary care settings. The increased ability of providers to manage psychiatric conditions successfully in their own practices without referring people, to drive 5 hours to the UNM emergency room, right? Which is not a pleasant experience for most folks. So given that there is demonstrated effectiveness of these programs, this model has spread across the US and actually out of the US. So now all states except 2, I believe, have PMHCA programs. And then there are several tribes across the nation, tribal nations, who have their own programs, and then also other spots like Guam and other US territories have their own PMHCAs too. Okay, and in the past several years, the model has expanded to include school services, sometimes perinatal services, to work with maternal mental health. And then also some programs have expanded into emergency room services as well. So, and these in red down at the bottom here are some of the goals and outcomes of these programs, right? A gain in skills, knowledge, comfort, and confidence following engagement with the PMHCA programs. Okay, so PMHCA is that acronym for the national model, and then NMABC is New Mexico's version of it. Okay, so NMABC is the PMHCA for New Mexico. That's a lot of acronyms. I know you have to just bear with me here. So NMABC actually stands for New Mexico Access to Behavioral Health Care for Children. But that's a real mouthful, so we just use NMABC. And the goal, as I said, is to support providers who then support children's mental health. So we don't do any direct work, at least at this point, with children and adolescents. What we do is work with providers who work with children and adolescents to try to support them in building their knowledge and their comfort around managing behavioral health and mental health issues. Okay, so again, consults, training, resources. So for consults, we do have a consult service, and folks can call our phone number, and we ask a couple of very quick questions, and then determine who in our clinical team is the best person to consult with them. And so usually same day, not always, but usually same day, we can connect that provider to a specialist, a child and adolescent psychiatrist, a psychologist, someone who is a specialist in autism services, in intellectual developmental and developmental disability services, infant and early childhood mental health. We have a really strong clinical team, so we can cover most pediatric mental and behavioral health issues. And consults can be quick or they can be longer conversation. It really depends. So we'll go into that a little bit more. And then trainings. So we offer free trainings that include free continuing medical education or continuing education units for healthcare and behavioral health providers on a wide range of youth mental health topics. And our trainings are generally an hour and often by Zoom, because folks are spread out around the state. And so staff groups or a small clinic or a tribal clinic, they can just contact us and discuss their interest in a training, and we can usually set up that training. Okay, and then resources. So when people need some support or help in identifying appropriate resources for a child or youth with mental health care needs, we can support folks in trying to do that. That doesn't mean that we can pull non-existent resources out of a hat, although we would like to. We can certainly help people identify what the options are for given situations. And we also have our website that has some online resources like screening tools and other kinds of resources. Okay. And as I said before, there's never any charge for NMABC services. It's entirely free for folks. Okay, so we've already told you this is a partnership between the Department of Health and the Center for Development and Disability at UNM. This was a 5-year grant, which will be ending in the late part of 2026, and then depending on federal government priorities, will either be extended or not. And it was initially authorized as part of the Bipartisan Safer Communities Act funding. So this was a bipartisan model and has been awarded nationally to 49 organizations. And then in 22, 23, and 24, NMABC received some expansion funding to offer services beyond just primary care providers. So also behavioral health providers and school staff. Okay. All right. So consults. As I said, we have folks who cover a wide range of expertise of different types of areas. And we do not collect patient identifying information. So if somebody calls us, we don't, get the name and the, insurance info and all of that for the patients that they're working with. We really just need to know what the question is. So, and some of the frequent questions that come into our consult service would be like, well, this particular medication that I've prescribed really doesn't seem to be working. What are my other options? I'm sorry for my cat now, who's going to make a little noise in the background. Or maybe the medication has been helpful, but there are some problematic side effects that are not good. So are there other medications that might do the same thing with less problematic side effects? Managing sleep or appetite issues, managing aggressive or self-harming behaviors, and finding appropriate resources. So those are some of the common things that come into the consult line. In general, anything related to prescribing, diagnosis, treatment recommendations, or challenging behavioral issues. Okay, and the steps are pretty simple, right? You just call our access line. We ask a couple of very quick questions just to find out who the call should be routed to. And then we get those folks together and they can figure out a good time. So, it can be, maybe I'll have a few minutes at 2 o'clock. So call me back then or whatever it is. So then we can connect. And some questions are really just a simple question with a simple answer. 5 minutes, it's done. And other times it's a more complex situation and they might arrange a real in-depth case consult to go through history and all kinds of issues. Okay. And then we also do follow-up. So if the provider wants it, we schedule a follow-up just to make sure that things have improved, that they don't need any additional kinds of consultation. So that's basically the process. And we've recently started an online scheduling too. So there are 2 half-hour blocks during the week that folks can just arrange an appointment to talk to one of our child and adolescent psychiatrists. And if those 2 time blocks don't work, then they can just call our line to schedule a different time. Okay, so then our trainings. these are the some of the free trainings that we do for healthcare practices, schools, clinics, hospitals, whoever. Just anyone who's really working with children and adolescents in New Mexico. Okay, these are some of the topics: infant and early childhood mental health, autism spectrum disorder, suicide screening and safety planning, non-suicidal self-injury, coping with loss and grief, brief intervention techniques, SSRIs, right, antidepressants, ADHD diagnosis and management, a whole range. And if there are other training interests, we can often find folks who have the expertise to provide those. Oh my goodness. Okay, all right. So for the consult service, for the folks who use the consult service in 2024, 100% felt that they had acquired new knowledge and skills from our program that that would be useful for them in screening for behavioral health conditions. And 86% felt more confident in their ability to manage behavioral health conditions, and 86% felt that more patients had received treatment due to these services. And there's one of the comments is, I have more knowledge to know how to help them now. And then trainings. There have been, every year we've offered trainings. There are a growing interest in them. So in the fiscal year for 24, we had 228 participants in trainings. And this year, actually that number is no longer accurate. We're at, I think, 581 who have attended trainings so far this year. And 100% have said that they gained valuable knowledge and skills, and that the trainings will have a positive impact on their professional practice. And just some of the random survey comments: great training, informative, helpful. Just what you want to hear. All right, and then this is our primary clinical team. And then we also have our project team, and we have a wide range of other folks in the UNM system that we consult with or can pull in for specific questions. So there's the email for NMABC and the phone number where folks can reach us. And that's kind of the upshot. Okay, so we would love to answer any questions that people have, or just to hear your comments, your thoughts, anything. We just wanted to open it up and have a conversation about this service.
Angel, I see your hand up.
Hello, everyone. Good afternoon. My name is Angel Ronquillo. I'm a community school coordinator down in the South Valley of Albuquerque for Los Padillas Elementary School. And this is really exciting because a lot of what our council has been focused on is trying to build a narrative to get a brick and mortar school-based health center in our area because of the distance, right? And so part of what this addresses is distance, right?
Yes.
But I do have two questions. So I didn't see it anywhere in the presentation, and considering that this idea came from the Health Sciences Center, I wonder, how are we leveraging our community health workers to be able to use this consultation network?
That's actually an area that we are planning to expand into: peer support workers, community health workers, community support workers. They're such a vital part of our service system in New Mexico, and we'd really like to be partnering with those staff members and advocates to meet their needs, whatever they may be.
Thank you very much. And if I may ask my second question, is that all right with the group?
Yeah.
Yeah. Okay. So considering especially Latino immigrant families, when it comes to paying for a specialist, any kind of specialist, it might be difficult, right?
Yeah.
So getting them connected is one thing. Getting them to follow through with the services is another. So are we exclusively, like, would this exclusively funnel clients to providers? Or is there an opportunity for us to maybe leverage community partners that are like nonprofits similar to Access New Mexico, who use like exercise for mental health instead of like medicine and medicating?
Definitely. Susan, do you want to respond to that?
Um, sure. I mean, I'm trying to figure out how to answer your question. I think, well, we're trying to build up our resource library, so your suggestion is good. And my program, Children's Medical Services, we do work with a lot of immigrant families, and we are a payer of last resort. If we're a Medicaid category, and we can help with paying for specialty care and prescriptions. There's some limitations. Usually the child has to have some sort of, it's very broad, some sort of actually medical condition, but it could just be an eye, condition, they need glasses or something. So I would offer you as a resource, because I completely understand that that is a huge barrier for families when they don't have a source of payment to follow through with treatment recommendations.
But there you're talking about Children's Medical Services, right?
Yes.
Which is a
Yes.
separate program than
Separate.
NMABC.
Separate.
Yeah.
Exactly.
And I think if you're asking, I may have misunderstood your question, but if I am understanding it correctly, and please do let me know, we do not funnel to specific providers. We try to meet whatever the request may be. So, if it's we're looking for, exercise or any kind of well-being programs or services,
Yes, ma'am.
rather than psychiatry or psychology, then that's what we will try to find, right?
Awesome.
It's
And
not
yeah,
really,
the question was answered with the library part, that you're trying to expand the resource library. I think that'd be awesome if we leverage our
Yeah.
community partners here in the state. Thank you to both of you.
sure.
Thank you.
Okay, Anna, see your hand.
Thank you. Thank you so much for this presentation. I am curious about the trainings that you all offer. I think you said at first maybe it's for medical primary care providers or physical health providers, but it's also now being offered to behavioral health providers. Is that right?
Yes, really any group of professionals or staff that work with children and adolescents in New Mexico who have an interest in these topics, if they feel that it would help them in their work. So that could be folks who work in schools. We've done many trainings now for different school districts and individual schools, and we have certainly done trainings for behavioral health programs and clinics as well. Did that answer it?
Yeah, I just got my internet's a little unstable, I guess. So, yes, so it's open to everybody. That's amazing. And then are these ongoing trainings on a calendar, or does a group call in and set up a training specific for themselves? And if they are on a calendar, would you guys mind sharing that link with us?
We plan some bigger events, but for the trainings that I was talking about in this presentation, those you contact us and it would be for your group. So if there's a group of 4 or more staff people anywhere in particular, we can arrange a training that would be, at a time that works for that group and on the topic of their choosing. And we try to tailor it somewhat within, the broader topic. Like, maybe it's related to ADHD, but really we're not prescribers and we don't care about the medication piece. We want to talk about school accommodations or whatever else the issue might be. So we do try to tailor them to that particular group. In terms of larger events that are open to many people, we've been doing regional summits on youth mental health. We had our first in the fall in Gallup, and that was wonderful. It was really an exciting event and open to all. And then in August, we are planning a regional summit in Roswell. So we're going to be there, and then we're hoping to get to some other spots as well. So, and those events are certainly open to anyone. Did that answer it?
Yes, thank you so much. And I do have another question, but I'll wait and see what other folks have.
Okay.
I think you can go for it, Anna. I don't see any hands at the moment.
Okay, I was curious if you all sort of collect data on the kinds of phone calls that you receive for the case consultations. Are they mostly related to, autism or to medications or to severe mental illness? Just kind of curious if you guys track that and what maybe some of the higher call volumes are related to.
Yeah. So a lot of our calls are specific for child and adolescent psychiatry, just because it's such a lack in our state that folks who want to access that specialty service have trouble doing so. And autism, anxiety, and ADHD are at the top of the list, and often co-occurring. So, often a call will be about a young person who maybe has a diagnosis of autism spectrum disorder and is also dealing with a lot of anxiety or, whatever other combination. And so how do we manage, help the youth to feel less distress about in a particular area, and how to balance that with other kinds of needs and issues that may be going on as well. So often they're kind of complex cases because children are all unique and complex, right?
Well, I have a question. So what types of trends are you all seeing at UNM around providers like in rural areas, frontier, tribal areas, who are supporting the youth mental health needs, maybe through your program? I definitely know there's like a shortage, but just seeing what you're all, just asking to see what you're all seeing as trends at UNM.
Trends in like rural and tribal communities.
Risks.
I think that, well, I mean, Susan may be able to address this better than I can, but we've seen a lot of interest in, we don't want our kids to have to travel 10 hours, and wait in an emergency room for to be admitted to the hospital for one day and then come home and nothing's really changed, right? We want to help support our youth to be stabilized and to get their needs met within their communities, because I mean that's where kids tend to do best, is in their own communities, right? So I mean that's certainly a trend that we've seen, is like help us to not have our children have to go far away, go out of state, or go many hours for services when we know our own community's needs best, right?
Yeah, I just to follow up with Amy saying, I don't think we've seen like a great increase in mental health providers, psychiatrists, not sure that we will. I think a one positive trend is the creation of the community-based kind of mental health hubs in certain areas of the state. And I don't have all that information for you, but I mean, I think the goal is to provide, 24/7 kind of wraparound care, not residential, but like crisis care and support services for people in their communities. And it's like a rebuilding of our behavioral health system that got kind of decimated many years ago, and rebuilding. And I think this legislative session, a lot of funds were approved and allocated to kind of help rebuild our system. So that's positive, but of course that's going to take time. And I think some things that we see, correct me if I'm wrong, Amy, but providers struggle with getting correct diagnosis. I think I've seen that with autism a lot. Trying to, which affects the services that a child can receive, in the schools, and the therapies that they need. Have specifically seen some requests from some of the tribal communities there. So that's where we're trying, like, NMABC isn't there to fix the provider shortage, but really try to shore up what we have and support the work that is going on in the communities, and be a resource and really try to bridge kind of that waiting period or those gaps.
Let's see, would community school coordinators? Yes, definitely.
Thank you.
Sure.
I have two additional questions.
Sure.
Susan, I was wondering what area of DOH you're with that's partnering with UNMH.
So I'm with the Public Health Division,
Okay.
and I am, which is big, but I'm situated with the maternal child health section. So I'm part of the Title V funding for children with special health care needs, and that includes my co-programs working around maternal health and midwifery, and the doula work that's going on, maternal child health epidemiology. So does that kind of
Yes, lots of things all smooshed together.
all smushed together? Yeah, all interrelated.
I'm curious to, and maybe you guys, this is not your area, but I'm thinking about our young people that are struggling with substance use disorder. And it's a challenge to kind of, for me, to keep track of what's out there for folks, for adolescents in that situation. And I'm curious if you guys can just maybe speak a little bit to that based on your work. If when you talked about resources, if you're making referrals, or kind of what we have in the state in order to kind of meet the needs of that population right now.
It certainly is, we still are not meeting the needs of that population right now, but hopefully services are growing. We do have someone on our clinical team who has really extensive expertise in youth substance use, who is available to help let people know what kinds of options are out there, and what kinds of services might be helpful in particular situations. But it doesn't really answer your question about our state systems related to youth substance use, which are still lacking in capacity, right? That's been an ongoing issue. But there have been lots of, as you're saying, it's hard to keep up with. There's often a lot of new programs and like, are they still there or did they fold, you know? And a lot of it is just helping folks, you know, figure out what's available in their particular, you know, region and area of the state, and whether or not those needs can be met in their region, right? Is that kind of an answer?
It's still, it's hard.
Yeah.
Have a lot of magic.
Oh, hello to the little person.
And there's a question in the chat, Amy, I think you could probably be good one to answer about collaboration with CYFD.
Yeah, so NMABC has been having ongoing discussions and planning meetings with folks who are managing the services for children in state custody, to see if there's any way that NMABC can support those programs to meet those kids' needs. And I would just say it's evolving at this point. We're doing some case consultation, but we're trying to figure out what's really the best way we can provide some support. There's so many different systems involved with children in state custody, and the, you know, the players are, you know, there's the UNM hospital administration and the state administrative folks, and you know, the MCO folks, and you know, it's tough to get everyone together at the same table, but there have been a lot of conversations, and there's a lot of will towards trying to do better in meeting the mental health needs of children in custody. That's another one of those, like, I wish that we had a nice, you know, we're solving the problem. We're not quite there yet, but we're certainly trying to have discussions to move in positive directions. So there's that. And we're available for CYFD staff as well in terms of our trainings and our consults. How do providers find out about us? Well, that's a good question. Through trainings and our, you know, we have email communications. A lot of it is, you know, word of mouth from folks who have used our service, then they're letting other people know about it. We are at conferences all the time with our little info table. You know, I think we've been at, I don't know, maybe 20 conferences this year, you know, for early education and youth substance use, and primary care providers and behavioral health providers, and just trying to put the word out. And it's effective, but it's really hard to reach everyone. We're a state that is doesn't really have centralized communication, right? So we're trying to just put the word out there as much as we can. Let's see, have we already connected with we've been at their annual meetings the past 2 years and have made some good connections, and also with the New Mexico Pediatric Society and the New Mexico Primary Care Society, or Association, New Mexico Primary Care Association. The Tribal HB Providers Association. We've been doing some trainings for different tribal nations, but we have not connected with the Providers Association. That's a really wonderful idea. If there's an email or a particular contact that might be good for us to share information with, please reach out and let us know.
Yeah, I could definitely maybe send an email after and connect you all with them.
That'd be terrific.
Okay.
Yeah.
I was just wondering, I've been trying to get a sense of the different trainings out there around behavioral health for folks. And it is really hard for people to find out what's out there. I've found some stuff, have started a very rudimentary little spreadsheet, and I've been in conversations with providers that have said, oh my gosh, we just hired somebody and paid couple $1,000s to have this training for our staff. Who knew this thing was out there for free? How do we find out about this? I'm gonna drop a link in the chat, and I'm not sure if you guys are already familiar, but the Healthcare Authority has a trainings calendar. It's called their Unified Behavioral Health Training Calendar. I don't know if it would work for the type of training that you all do, since it's not like every fourth Wednesday, you can do an autism training, but maybe there's a spot on there for there to be a link or for folks to find more information about these specific types, because I haven't seen, again, just even autism training or ADHD trainings that are out there on this particular calendar. And it's, as I said, at the Healthcare Authority. So it might be a way to, again, just continue to try and figure out how we get the information about the really good stuff that is happening in the state out to all of us, especially given how rural we are.
At our last advisory board meeting, that was something that came up because we're doing a lot of trainings, but we get a lot of requests. And there are times when we don't have the right person or the right whatever. And so we've been talking about trying to create an online, not clearinghouse, but a place where people could go to just find free trainings from anyone who does them in the state related to child and youth mental health. It's not about us doing it. It's like, who's available, right? To meet that need, who can best meet whatever the need is for training. And I think that was one of the suggestions that had come up, was that state calendar, right? So we
And
got to
I-
look into that.
We have to look at it. And yeah, I mean, maybe it's a place too, I don't know, we'll have to look at it to offer the consultation as well. I don't know, but maybe if we talk to HCA, we could work on that. I mean, I just wanted to add one thing, because I think it was kind of interesting. We're also training like people you wouldn't think want training, like for what it came to mind is we had our WIC program ask us to do a training on autism. And to me, that makes perfect sense, because they work with families and children all the time, and they should be trained so that they understand and kind of know who to call or to refer families to, or so that's just an example of folks that reach out and you may not think of them.
Yeah, like the WIC nutrition staff said, sometimes we're the person who is most familiar with the child and can really help link them to other services that they may not be aware of. And so, like Susan's saying, it certainly is not just healthcare providers or, just anyone in particular. It's who's ever working in the community with kids.
And then there's a question in the chat: can foster parents and grandparents receive training?
We haven't done that so far. Like right now, we offer training for CYFD staff at any level, and in any of their programs, but we have not offered any training to foster parents and grandparents. I know they have required trainings, that particular curriculum that they need to be going through, but we're really, our mandate is about people who work with youth, and that's not defined as family members, but boy, there's a I mean, it would be wonderful to offer trainings for foster parents and grandparents. It's something we haven't done yet. And I don't think we actually have the capacity right now to do that, but it would be a wonderful thing to expand into if we could.
And I
Thank
know that you mentioned, this is a federally funded program, is that right? How long is your your funding supposed to go through?
The end of 2026, and we're certainly looking at all options in terms of making this a permanent, sustainable program within the systems that we have available, because federal funding is certainly evolving right now.
So we have about 4 more minutes. Are there any other questions for Susan or Amy? Okay, well,
I don't have another question, but if I can just make a plug for utilizing a training calendar that's out there, just as someone who has like, familiarity with navigating a lot of the different public websites, it can take a whole afternoon, just clicking links into links into links and to finally get where you want, and then you don't even remember how you got there. And you can't quite figure out once you're there who led you there and what this is connected to. So I think utilizing something that already exists, or figuring out a way to expand something that exists to meet the need would be a really great service to providers who are trying to figure out, how to find out about and access what's out there to support them. So just a little plug.
No, that's an important point, right? Instead of creating yet another website that people don't know about, right? To try to expand on one that's already there, that people are becoming more aware of and that could be shared, right? That's ideal. Well, we really appreciate the opportunity to come and share some information. And if there are any other questions, or you just want to, talk about ideas, or maybe set up a training for a particular group you're aware of, please just get in touch. The nmabc@salud.unm.edu is certainly an easy way to get in touch with us. And then I can put my email in the chat, and Susan, maybe you could as well.
and then this recording will go out next week. So if you want to review anything, the slides will also be there. So if you'd like to share them with anybody in your community, that'll be there as well. And if you aren't able to snag these emails, just let us know and we can get you in touch with one of these fantastic folks here. So before we wrap up, Val, do you have anything you would like to say in the last 2 minutes?
Happy Friday, everyone. Thank you, Amy and Susan, for this very resourceful, informative presentation, and to health councils and public health partners, community members who are joining us today. Just a quick little reminder, we have a very timely and I would dare say pivotal convening that the Alliance is hosting on May 7th, called the Community Collaborative Forum. We seeded this convening back in 2023. Anyways, with everything that's going on, right, on the federal side and changes that are coming down the pike, implications on public health and many other sectors, as well as now having had the governor sign on our state budget and learning about which legislation made it through, and of course our state partners with their priorities for the coming year, and our community coalitions like health councils working on very specific priorities. This is a great opportunity to come together, debrief on all of the above, see where the work aligns, see where there's opportunity for collaboration to, break down those silos, also enhance the capacity of some of the folks out there, boots on the ground, lifelines to community members who may not have that capacity. So it could lend itself to collaborative opportunities, funding opportunities, and also a way to have the ear of our elected officials, who a lot of them are going to be with us, including Lieutenant Governor Morales and Speaker of the House Martinez, as they get prepared for interim session, right? So this is a great opportunity to also make your voice be heard about what's most pressing, right, for each of us in this arena of improving the health and well-being of our communities in the various ways that we do that. Interim session starts in June. May is the perfect time to make our voices be heard as well. So it's, like I said, a very timely and hopefully pivotal convening for May 7th. And Sam's going to plug in the registration link in the chat. So I welcome you to please register if you haven't already. And also share that invitation within your networks, Amy and Susan and others. The more diverse representation that we have, right, the better. Happy to answer any questions that you may have. And of course, Anna and Geraldine and Sam, we're the fabulous four, somehow manifesting this with the support of our sponsorship partners and Community Collaborative Forum Planning Committee. And yeah, it's hard work, my friends, in service of New Mexico. Anything else, team? Sam, Anna, Geraldine, anything else to chime in? Look at us. Over time, sorry.
Well, thank you everybody for joining us again. Be on the lookout for this and much more next week. I popped the registration link in the chat. That's it. I hope everybody has a great weekend and we will see you next week.
Have a lovely
Bye.
weekend.
Thank
Take care of
you.
yourselves.